I'm Sarah Hiner, and welcome to the Health and Happiness Show. Today, we are going to talk about testosterone. We're going to talk about hormones, which sounds really technical, but it doesn't have to be. And the important thing is there are a lot of myths and things that people don't understand about it. They have a lot of assumptions about testosterone, but that's not necessarily the truth. So we're going to be talking to Dr. Mark Strengler in just a minute. Actually, I got him. You're seeing him right now there because I have us on the gallery view. So I'll introduce him and tell you how great he is in just 1 second. I have to give all my regular reminders for you. We have a growing number of videos that are in this library on Facebook, but also on our YouTube page. So go ahead, go there and subscribe. We're almost at 10,000, and that's a really big number in YouTube land. So go check that out. I've got hundreds of videos that are there that we've been collecting through the years, all sorts of interviews with all sorts of top docs. So go ahead there if you want to be able to see things that you've missed, because I do these every week. If you want to watch this again or watch anything else again, share it. You saw a great conversation and you want to share it with somebody else. It's easy to go there and find the video and then share it with people. We have an exciting project I'm working on about happiness. I was just telling Mark, a book that actually I'm hoping to write and publish, which we've never done a trade book before, but it's about happiness. We are having a major happiness crisis in this country. And bottom line team is working on developing a membership. We're going to launch a membership about happiness and about connecting our minds and our bodies and reawakening the happiness that we all have in us. We know it's there. We were giggling when we were 3. So what happened to that? And how do we refine the way that our body knows how to be happy? I'm doing a webinar on that on February 25th. It'll be 4 o'clock. There'll be a link so that you can register for that. That'll be in the little chat on Facebook. So come join me there. It's going to be a fascinating conversation. And I'm really excited. We have so many people working really hard on this to be able to help everybody refine it. It's a really hard time right now. And, somehow people are always chasing that magic, if only, then I'll be happy. Well, let's get over that if only and find your happiness that actually can exist and does exist every day. 2 other things to download. There'll be links in there. I remind you about these every week. Your immune system. We're all worried about COVID. We're all worried about getting sick. We're wearing masks and still social distancing and staying home. The stronger your immune system is, the less likely you're going to get sick. That's the bottom line on it. Facts. And Mark will validate that. But right? Mark, yes?
True. Yes.
So the bottom line, editors, we put together a book of information about things that you can do to boost your immune system, to strengthen your immune system, to reduce your risk of getting sick from anything. This is not COVID specific, but your immune system works as your guard against so many diseases. So download that. It's free. Share it. Tell your friends to download it. Honest to goodness, all I want is people healthy. We have another download about pain. Same thing, lots of aches and pains, sitting around way too long on too many screens, necks, backs, shoulders, you name it, we're achy. So we have another download. So again, just trying to share as much as we can to help people get healthy. All right, let's talk testosterone with Dr. Mark Strengler. Let me introduce you. I always read my bullet points. Oh, one other thing, if you have questions or comments while we're going through this, put them in the comment box. Lauren will pass them along to me, Hidden Lauren, who I refer to all the time, but you don't know who she is, but she's awesome. She will pass them along to me and so that I can share them and ask Mark about them. All right. Mark Strengler, naturopathic doctor extraordinaire. He was voted the 2019 Doctor of the Year by the prestigious International Association of Top Professionals. He is the founder of the Strengler Clinic for Integrated Medicine in Encinitas, California. And he specializes actually in treating complex medical conditions that are not easily diagnosed or treated with kind of common Western principles of symptom suppressing medications. Naturopathic medicine is about helping your body to do what it knows how to do versus got a problem, let's suppress that. We'll just dial down the hot water and then you won't be hot anymore. Naturopathic medicine, an entirely different philosophy. We've worked with Mark for many years, including we published a number of his books. He has authored or co-authored 30 books, including several of our bestsellers, as I said, several bestsellers across the country in the trade books. The Natural Physician's Healing Therapies is one, Prescription for Natural Cures, Prescription for Drug Alternatives. They are fabulous reference books that can help you understand symptoms, how you can help yourself, how you can help yourself be healthy. They are all available at your favorite bookseller or also at our Bottom Line Wellness store. And he has a new book, which is what prompted us to talk today, called Healing the Prostate. That is available, not yet in our store, but wherever fine books are sold. Why? We need to get that in there. And you can learn more about Mark at markstrengler.com. So now that I've done that lengthy introduction, hello, my friend.
Hey, good to be with you, Sarah.
It is good to be with you. All right, this is gonna be structured a little different than normally because I usually have this meandering conversation. We're gonna do myths. I've got 1, 2, 3. I've got 5 myths, 5 major myths about testosterone because people don't understand it. They assume it, they see headlines, but they don't get it. So I'm just gonna go myth, and then we're gonna talk about each myth. So first and foremost, the biggest thing about testosterone, I think, is that people assume that it's all about sex and all about the sex drive. But what they need to understand is that it actually does a whole lot more than that. Yes.
Very true, very true. And it is true, testosterone definitely plays a role in the sex drive. It plays a role in men in terms of erectile function, women being sensitive during relations, but much more than that. Think testosterone, think muscles, not just the muscles when people are working out, but your heart's a muscle. So anything to do with muscles, testosterone is a very important hormone for it. It plays a major influence on muscle mass, muscle strength, heart function, heart contraction, for example. Plays a major role in bone density. So people are deficient in testosterone, more likely to lose bone mass. There's been many studies showing it has a pronounced effect on brain health, the structure of the brain, the function of the brain, cognitive function. We know that men that are deficient in testosterone are more likely to develop dementia, for example. Mood. We know that especially men who are deficient in testosterone are much more likely to have depression, studies show. And so you can see there's a lot of different systems that testosterone affects other than the sexual system.
So here's the fascinating thing that always, I think, intrigues me about when you think about the whole system, like that it's such a one-to-many relationship. So, you talked about muscles, and yet it's affecting mood and it's affecting bone density. Like, how does one hormone affect so many systems in so many ways? And that's true of a lot of things in our body.
Yeah, very good question. Well, the main reason is because throughout our body, we have receptors for testosterone. So there's receptors for testosterone in the brain. So when testosterone activates those receptors in our brain cells, it actually helps with the production of certain neurotransmitters, say like serotonin. Or in our bones, there's receptors for testosterone, so it activates special cells called osteoblasts, which make bone, for example. And the same thing goes, with our muscles. So we have receptors throughout the body and many of the different organ systems and tissues for testosterone. So that's why it has wide-ranging effects on the body.
And that those receptors are there because it affects it, but I guess does it do different things in different places? It's just the body just so fascinates me. And I talked about the immune system before, that what our body is able to do in the different places. And I just want people to be amazed by the magic of our bodies.
Well, it's very amazing because think of this, I'm giving a very simplistic model, but to answer your question, yes, it does different things with different receptors. But basically the way testosterone works is when it attaches to those receptors sticking out from our cells, our cell membranes, it then's transported into the cell and it affects the way your DNA gives out information, how your DNA is telling your body how to make certain proteins, how to carry out certain functions in the body, for example. So it could tell your muscles to make, the proteins needed to make muscle mass, for example. So yes.
So it's like it's a trigger for all those different things.
Right.
Got it. All right. So meanwhile, though, is it true that one of the myths about testosterone is it's about virility, and what I mean, like aggression and kind of violent behavior? I mean, is that true that there's a correlation between high testosterone and being being a fighter, a warrior?
Yeah, not really. When you look at the studies, not necessarily, because there's two different things at play here. Number one is, your production of testosterone, and like you said, your blood levels of it.
Right.
But then there's the other thing which we can't test in a general sense, and that is how sensitive your receptors are to the testosterone. That's why maybe I give a man or a woman testosterone replacement. The doses I need, even for the same body weight, could vary greatly depending on the sensitivity of the receptors in their cells. That's why people are different in that way. So in general, I wouldn't say that. We do know, it does give masculine kind of male type of predispositions. That's true, but only within certain parameters.
Right. And masculine physical characteristics.
Right, right.
Right. But it's not like the, the steroids. We'll talk about steroids a little bit more later, the anabolic steroids and the misconceptions between those two. So testosterone is not that.
Right.
You just mentioned you give it to women. So testosterone is not just a man thing.
No, no. For those of us doctors trained in hormone replacement, no, we use it quite a bit with women. We see quite a few women who are deficient in testosterone around the menopausal age. And so the ovaries make testosterone, just like men make estrogen. A lot of people are led to believe one's a female hormone, one's a male hormone, but no, women make testosterone as well. And again, very, very important for all those different functions I've spoken about.
So ovarian function, and you talked about bone health as well. So women, right.
Yes. Yeah. Well, women, it would be similar. I mean, it definitely can affect cognitive function, women, energy levels, muscle mass and muscle strength, bone density, definitely, plays a role in libido as well.
Okay. Women, this is for you too. It's not just for the men. All right, let's go back up. So now that we know that it affects so many other parts of our body, people talk about in general, hormones go down, right? Women always talk about that, their hormones reduce as they age. Does testosterone, and there's a lot of commercials and advertising for low T and low testosterone, and that's kind of like the new trendy thing. Does testosterone necessarily go down as you age? Do men necessarily, is it normal to reduce? I know that, there's a significant amount of older people that do have lower testosterone, but is that the way it's supposed to work? Does that normally happen?
Yeah, it definitely decreases as we age, drops about 1 to 2% a year in men starting about age 40. So that's been pretty well researched. I think the issue that comes in for some people, it declines more rapidly or it gets too low altogether. And there can be different reasons for that, depending on genetics, illnesses people have, maybe medications they've used. So, but yes, over time, the hormones just in general decrease, and that's true of testosterone. So menopausal women, we see it quite often. That's when it begins to drop. And there are studies showing about 40% of men over the age of 45 have low levels of testosterone. And then about 25% of men over the age of 60 have deficient levels of testosterone.
And there's some of it occurs naturally, as you said, bit by bit, but there's a lot of environmental factors also that have accelerated that, environmental toxins and things like that. Yes?
Yeah, absolutely. There's this whole category, what they call now endocrine disruptors, endocrine being your hormonal system. So people may have heard of like the phthalates you see in plastic bottles. Studies show about 75% of Americans, when you check their urine, you can find the phthalates in there. We used to have BPA, as you know, as a plasticizer in bottles, dioxins from chemical processes like bleaching paper, for example, or even mercury. Mercury you could get from fillings, from seafood like tuna. That's been shown to throw off the hormonal messaging system and lower testosterone as well.
So, and it's really amazing. They keep trying to find alternates to plastics or to reduce the plastics, and they knocked out BPA, and then they had some alternate that is just as bad as BPA. We can't get away from those plastics, can we? I mean, literally, it's even if you want to do your glass bottles and whatever, plastic is in everything around us.
Yeah, I mean, if you don't ever eat out and live in a cave, you're right. So it's a problem. It's a problem in our environment. But I think that's where the naturopathic principle of detoxification is so important. I mean, we can only, to a certain degree, control the amount of toxins we're exposed to, but we can control more greatly through our diet, purified water, exercise, saunas, other things. We can control our ability to detoxify these substances.
And then we're going to talk about that. We're going to talk about what we can do in terms of being able to build back our testosterone. How about also there's other things that are affecting testosterone levels, like obesity, weight?
Well, that's a huge one. That's a huge one, with 70% of American adults being overweight in our country. And the reason for this is fat cells contain an enzyme called aromatase. And basically, aromatase is an enzyme which makes estrogen in the body. So in terms of men, as I said before, men have estrogen. But when your estrogen levels go up, one of the main causes is being overweight because your fat cells will make more estrogen. What it does, it interferes with a signal from our brain, the hypothalamus, a part of our brain, which ultimately goes to our pituitary gland in our brain and then to the testicles. And basically, we have high estrogen levels. it diminishes that signal from your brain to your testicles, telling it to make testosterone. So men end up with a higher estrogen, and then it suppresses their testosterone level from being overweight.
And then so then if they go through that cascade, then that makes them vulnerable to all these other things, heart disease, brain, bone, et cetera, et cetera. How about,
Right.
is one thing that people have to be aware of or pay attention to is the ratio. So that not only is it, you have low testosterone or you have low estrogen, but suddenly with what you're describing now, the ratio of estrogen to testosterone seems like it's also would be getting out of whack.
Yes, no, you're exactly right. So lower testosterone, higher estrogen. So it's really what we call like a form of estrogen dominance.
Mhm.
The estrogen is just too high relative to the testosterone. And in men, studies have shown when the estrogen level is too high, it reduces libido, it contributes to sexual dysfunction, it leads to increased breast tissue, it leads to increased abdominal weight. So it causes problems. You got to have the proper balance. I mean, men have estrogen. It does have functions in the
Yeah.
human body.
Right.
It actually, estrogen in both men and women is one of the most powerful antioxidants that's ever been discovered. It's a very powerful antioxidant. So it has a design function, but like everything else, it depends on balance.
See, that's one of the most fascinating things. And I've been listening, talking to people and researching this stuff for years. I never heard of estrogen as being an antioxidant. We think about all the other antioxidants, think about what estrogen does, but back to just the amazing thing about the human body. And I'm sorry to keep harping on this today, but like that the multi-purposes of all this stuff in our body, it's just fascinating to me.
Well, it's true. And, that's why in menopausal women, and this has been studied in literature, they know this to be a fact. That's
Right.
why menopausal women tend to develop more arthritis in those years, because as their estrogen drops, they lose that antioxidant effect, which also has an anti-inflammatory effect in their tissues. But Sarah, that's why I look at the body from engineering principles.
Yeah.
I mean, if you start looking at like an engineer and a multifunctional, multi-purpose system, it becomes very interesting.
It's just, I mean, the more I talk to people, just the more remarkable our bodies are, and the more respect that I think people need to understand of this incredibly powerful engine that we have if you know how to drive the car.
Mm-hmm.
Right. And with these lifestyle choices, with what we eat, with lack of activity, with the environmental toxins, we're gumming up our engines. So, which is,
Well, yeah, and Sarah, we have this whole relatively new field. I mean, it's been around for 15 years, but it keeps getting more and more improved in terms of knowledge. But this whole field is epigenetics. In other words, the foods we eat, the toxins we're exposed to, it influences the way our genetics carry out their information. You could use, foods and things like that from our environment in a positive way for our genetics to give better information out to ourselves, or it can disrupt the proper information from our DNA and can lead to breakdown.
yeah, I mean, it's just amazing. All right. One other, I think, really important aspect of low testosterone or reduced testosterone is medications. But there are a lot of medications that actually may be suppressing. Is it suppressing our testosterone or suppressing our ability to produce testosterone?
That's a good question. A lot of these things, the mechanisms haven't been thoroughly worked out. I mean, I was surprised to see there's research, very clear research showing that opioids, and of course, we've had this opioid epidemic for many years in America, suppresses testosterone production. We know that corticosteroids like prednisone, some people take for inflammatory autoimmune conditions. That I know how that works because, again, it's this messaging system, this hypothalamic pituitary gonadal axis, they call it. So the messaging from the brain, that gets messed up because we have to remember our hormones really work like an orchestra. They don't work in isolation. And so that's even as a doctor, when I check hormones, I don't just check one, I check a wide variety of them because they interact with one another. But you start putting in other hormones, especially synthetic ones, you start throwing off hormone balance. For example, it's a well-known fact if you look up birth control pills, and I'm not here to knock birth control pills, but it's well-known fact that they, suppress testosterone production. So a lot of women wonder why, maybe they have lower libido and things like that on birth control pills. Well, it lowers your testosterone. Antidepressants, some antidepressants have been shown to lower testosterone. People have been through chemotherapy and radiation that can damage, the testicles or the ovaries, and that's the problem there. And then heartburn medications, because they suppress stomach acid, and you need certain nutrients to manufacture testosterone. So it's very interesting. Our body uses cholesterol as the building block of all the hormones, including testosterone, but then you need other nutrients involved in the pathways to make testosterone. One of the big ones is zinc, and the other one is vitamin D. So we need stomach acid to absorb those nutrients from our food or supplements. And so if you cut off the stomach acid, you end up with nutritional deficiencies.
So anyone that's on these medications, on some of them, the acid suppressants, maybe you use it sometimes intermittently, but a number of these things, steroids, people will go on and off, or some people are on them indefinitely. Antidepressants, obviously, opioids, frighteningly, they're on it far too long than they should. But talking to their doctors about their hormones then needs to also be part of that conversation. They need to be aware that if they're going to go on these things, then it's going to have a cascade of effects.
Well, yeah, think about this for a minute. I mean, let's say you have depression, right? And let's say you're one of these people where you're antidepressants lowering your testosterone. Well, as I said, especially more well-studied men, I mean, low testosterone, one of the symptoms is depression. So maybe you're making the problem worse. So unfortunately, doctors just don't routinely check testosterone. But like you said, if you're on these medications of other risk factors, you should have it checked at least once a year.
You should be checking. Now, this is interesting. You mentioned in passing, D deficiency and zinc deficiency are also risk factors for lowering testosterone, right? I'm going to do one of my famous, infamous Sarah Hiner, pull a piece from here and pull a piece from here and make up a theory, and you can tell me that I'm wrong. So D deficiency and zinc deficiency also correlated with higher risk of getting COVID and higher risk of dying of COVID. And men seem to be more vulnerable to COVID than women. Do any of those pieces all work together?
I mean, possibly. I mean, testosterone also, like everything else, it also ties into your immune system. Testosterone ties into our ability to recover, including from acute illnesses. So, for example, there's been research out there even for something different like burn victims. People with burn victims are given testosterone, they recover much more quickly. And so it does tie into the immune system and controlling inflammation. So there definitely could be a connection there.
Interesting. It's just such a fascinating puzzle. All right, let's move on to myth number 4. Actually, no, before I do that, still part of this. What are the symptoms of low testosterone? How does somebody know that they've got a problem?
Yeah, well, besides low libido would be a very classic symptom, both men and women. Men, it can be erectile dysfunction, another classic symptom. But beyond that, the most common one I see is fatigue. I mean, fatigue is a common symptom for both men and women of testosterone deficiency. Another common one, even with proper diet and exercise, you're getting weight or fat accumulation in the midsection. So that's another one. We talked about.
And it's fluffy fat, right? It's not. It's like you can get weight, but there's like fluffiness. I always called it, like women when they hit menopause, they get fluffy.
Yeah, kind of the rolly fat. Yes, right. Yeah, I'd say that's true.
Yeah.
We talked about loss of muscle mass, or people who are in good shape, they work out and they just can't recover. I mean, they should recover in a day or two, and 4 days later, they're just still so sore and stiff. That could be another symptom of low testosterone. Memory impairment, like I said before, in both sexes. So those are some of the other symptoms of low testosterone.
So now a bunch of these things, fatigue, everybody's fatigued. Right?
Yeah.
Memory impairment, I haven't remembered anything since I gave birth the second time, right? But they also kind of parallel with aging. So how do you know if it's testosterone or something else, or does it matter? Is, again, testing your hormones part of understanding your body's overall health? If you're feeling those symptoms and you go to your doctor, make sure that they're checking your hormones in addition to being sure that you don't have, whatever other direct things might cause fatigue or.
Yeah, well, I'd say two things. I mean, usually when I'm talking to patients, usually I'm just seeing like 2 or 3 primary symptoms popping up, as low testosterone. So that gives me, the hint they may have low testosterone. Right. But in the end, yes, it always ends up being just checking the hormones, because as you said, there's many causes of fatigue. There's many causes of weight gain. There's many causes of depression, low libido. So when I see like 2 or 3 symptoms popping up, or one extremely strong without really obvious reasons, for, let's say, for example, someone has a good relationship with their spouse, but they have very low libido. Well, it doesn't seem like there's, mental emotional factors going on there. So maybe they have, testosterone deficiency.
Right. And testosterone deficiency is not necessarily correlated with sperm problems. Is that right?
Well, in males in puberty,
Right.
As the testosterone goes up, it does actually initially kick in telling the testicles to produce sperm. So it's
Mhm.
actually involved in puberty.
But later on, if someone's having a problem with fertility,
Hmm.
is
Yeah, not
te-
typically.
testosterone is not necessarily associated with a fertility problem.
Right, I agree. Yes, in adult men, it's not. And actually can be the opposite. So men who are on testosterone, it can have the effect of suppressing sperm production. So if you got, a couple that are trying to have a child, become pregnant, you don't want to be giving that man testosterone because you could be messing up his ability to produce sperm.
So even if so let's play a scenario here. So I'm um, testosterone deficient,
Hmm.
right? For whatever reason, my testosterone is low. Maybe I'm
Hmm.
on, and I don't, whatever, I'm on a drug or something. My testosterone is low, and I'm having trouble. My wife and I are having trouble getting pregnant. Replacing that testosterone would not, the coming
Yeah,
back
we
in
wouldn't,
place of
right.
Stacy still would not be it, because that would still
Mhm.
negatively impact the sperm, even though my testosterone is deficient. So a lot of things you think about getting up to a level of normalcy is
Yeah,
healthy, but in this
yeah.
case, it's not necessarily.
Yeah, so let's say you got a 40-year-old male, maybe 45 years old. They're trying to, him and his wife are trying to become pregnant. He's got low testosterone. No, you would not want to give him testosterone replacement. And the reason for that is in our testicles, we have receptors, for a hormone called FSH, follicle stimulating hormone. Women actually produce it too.
Right.
So it's this message again from your brain down to the testicles, but that hormone tells your testicles to make sperm. So when you take testosterone, there's this feedback mechanism, and then that message greatly reduces. So no, fertility specialists would not be happy if their male patient was trying to, a couple is trying to get pregnant, and you're giving the man testosterone replacement. They would not be too happy with us.
It's fascinating. I'll just say that for the 1000th time already today. All right, let's move on to the next myth then, which is that the only way to solve your testosterone problem is to use hormone replacement therapy.
Mhm.
And that would be false.
That is false. I mean, that's mainly what you see promoted out there in the ads and the media and stuff. But no, it's not true at all. By the way, one of the things I should have mentioned earlier, the American diet is also a promoter of testosterone deficiency. So just by improving your diet, you may be able to improve your testosterone. We know there's some research that when people have like insulin resistance, high blood sugar, prediabetes, diabetes, because remember, insulin's a hormone. Remember, I told you how everything's kind of
Right.
interconnected here. The hormones like an orchestra, so that can suppress testosterone production. So that's another reason why people can have low testosterone. But no, what we try and do with patients, we do the groundwork first. So we improve the diet,
Mhm.
reduce the refined carbohydrates, increase the vegetables, the healthier fruits. Got to reduce the alcohol. Alcohol has definitely been shown in studies to suppress testosterone production and increase estrogen,
All
both
all
men and women.
alcohol, all alcohol and
Mhm.
excessive alcohol, or one or two glasses a night is okay.
I mean, if someone has a low level, no, I wouldn't be having more than a couple drinks a week.
Yeah.
Yeah.
And
So
alcohol is alcohol. So all that, red wine is healthy for you. Now,
well, think about it. I mean, it came out about a year ago. I mean, let's say women with a history of breast cancer.
mhm,
I mean, they don't want you to have more than a couple drinks a week because what it's been found in terms of cancer, even one drink a day on average could be a risk factor they found in recent analysis. So you got to be careful with that. I like more of like a modified Mediterranean diet. I'm sure your viewers are familiar with reduced grains in that. Of course, try and getting the hormone-free, dairy products and meats, I think is important. Sleep. If someone has a sleep problem, that could be, the cause of their low testosterone amongst other hormone
mhm.
imbalances. We got to improve the sleep. Exercise. People always think about lifting weights, and that can help with testosterone production. But there is research showing even aerobic exercise increases testosterone. So it doesn't have to be weight for the people who don't like, resistance training. And then what I do for patients, if they're mildly deficient or just on the low side of normal, I prefer to try and get their own levels up instead of giving them replacement.
Right.
That's a better way to go. It's easier for the patient, don't need as much monitoring. Obviously, the safety factor is going to be better. So there are certain herbal extracts shown in human published studies to significantly increase testosterone levels in both men and women. And one of them is ashwagandha. A lot of people think of ashwagandha for its great effects on stress. You know, it helps to bring down cortisol, helps people to feel calmer. It's an adaptogen, helps people adapt to stress. But certain types of extracts of ashwagandha in published studies in just in the last 2 years have shown to be very effective in raising testosterone levels. So I use that quite a bit with patients. Another one called Uracomia Longifolia, kind of a weird name, comes from Malaysia.
Does it have a nickname?
Yes, Tomcat Ali. I don't know if that's any.
Oh, that's so much better.
Not Tomcat, but Tong, Q-N-G, Cat Ali.
Yeah,
I don't know who came up with it, but
there's no common name. So this is actually one for the experts that are aware of this.
Right. So that's been showing increased testosterone levels in men too.
Mhm.
And then, as I mentioned before, nutrients. We want to make sure we have adequate zinc levels, adequate vitamin D. And the research on magnesium is kind of conflicting, but magnesium may be important in forming testosterone as well.
So can people, though, things like ashwagandha, things like Tomcat, I always say that natural medicine is not do-it-yourself medicine.
Mm-hmm.
It's tempting to be able to go to Whole Foods and buy some ashwagandha and take it. Is that a safe thing to do? Are there safe levels of it? My opinion is always go to the expert, get yourself checked, because you don't know what any of this also interacts with any of your other medications or anything else going on in your body.
I mean, if someone has a pretty clean health history, I mean, they don't have, history of cancer and breast cancer, hormone-related cancer and stuff like that, I mean, honestly, it's pretty safe. But the problem runs into, how do you know it's working? I mean, unless you're doing your blood level.
Right.
Yeah. I mean, unless you do your blood level, do a certain protocol, and then say recheck 2 to 3 months later. I mean, how do you know it's even working?
Well, would you have improvement in your symptoms? Might I get more?
You could. I mean, yes, I should say objectively, how do you know it's working? But you can know subjectively. That's true.
Right, if you're feeling better.
Yeah.
But again, it's interesting, back to that eating healthier, sleeping better, and exercising. Life's not that complicated, right? If we all did that,
that should be that. I mean, right there for a lot of people, I've seen people's levels double just by doing basic things like that. Losing 10 pounds, I've seen their levels normalize. Going back to your point though, I mean, medically, look, there are some rare conditions people could have which are serious as to why they could have testosterone deficiency. They might have a tumor in their pituitary gland, and that's messing up the messaging, to the ovaries or testicles. So, I mean, there are some things which is why we like lab tests as doctors. We always rule out the more serious things first, and then focus on treating the patient.
Yeah, sleep's always a big one. So is it 8 hours? What's your theory on sleep? There's people that say, depending on when you sleep, it's the time, it's not necessarily the amount. Different people need different amounts, 6 hours a minimum. Like, what's your theory on it?
Yeah. I did review this recently. I finished the Master's of Biology program. We did go over this. It is true you get your most regenerative sleep in the early morning hours, from about 4 to 6 a.m. So that's something to take into account. Most studies, they seem to be about 7 hours is what most of the studies tend to suggest is kind of for most people. Also, some people, an hour less, some people an hour more, but that's kind of the general ballpark. But a lot of interesting things go on during the night. I think I use the analogy of like a rechargeable battery.
Mm-hmm.
I mean, if you use your rechargeable battery up and there's not much juice left in it, obviously you got to charge it again. So our brain, our body, our cells are the same way at night. That's when our body regenerates in terms of our immune system, reducing inflammation, cell turnover and healing. Look, even the last few years, they've shown that our brain has this whole unique organ system called the lymphatics. And when we get proper deep sleep, it actually takes the metabolic toxins out of our brain cells, and they're now finding it even reduces your risk of dementia. Obviously, if you have sleep problems, which people's sleep problems are more prone to dementia, one of the reasons is you're not cleaning out that debris that you should be at night.
Yeah. So I'll go off topic a little bit here. What is your Dr. Strangler's favorite recommendations to patients that say they're having trouble sleeping?
Well, try and figure out, what's going on. If it's the kind of patient that tells me their mind's racing a lot, it's related to a lot of stressful things going on, which is pretty common nowadays.
Right.
I'll have them exercise 2 hours or longer before bedtime, because after about 2 hours, your stress hormones will drop. While you're exercising, they go up, but then they'll drop. So that actually has been pretty well researched.
So let me just clarify that. So you don't want them exercising for 2 hours. They shouldn't exercise within 2 hours of bedtime.
Correct. Yeah, 2 hours or more. I don't know, maybe I didn't word that right, but 2 hours or more away from going to bed. That's right.
Okay.
Yeah. Yeah, thank you. And so then avoiding computer screens, iPads, iPhones, anything with blue light. It's confusing to the brain, suppresses melatonin production.
Mhm.
No news, don't watch the news, listen to news, read bad things,
Right.
2 to 3 hours before bedtime. And then, if that's not sufficient, then we use things which calm the brain without side effects. So things like GABA, amino acid GABA is very good. Amino acid L-theanine. In more recent, the past year, I've been using a lot more CBD extracts with good results. So just things which can calm the brain in a non-toxic fashion. Of course, there's always melatonin. Melatonin is always a possibility. It works in some people, it doesn't work in others. It depends what the root cause is. But again, remember, cortisol, when it's high at night, which it shouldn't be, it should be at its lowest, it suppresses the sleep hormone melatonin, which induces a sleep cycle. So that's the connection there.
Right. Okay. So calm yourself, and we've got like sleep hygiene, get off the screens. Are you a believer, like, for blue light, because people are on screens, there's a night setting on the screens. Is that worth it? Does that do anything, or is that just kidding themselves?
Yeah. Honestly, I don't know the answer. Yeah,
Right.
I don't know the answer to that question. It's a good question. I don't know what the research shows on that.
I've said it to my kids, like, get off the screens, and they go, "Oh no, I have it on the night setting. It's fine."
Right.
And I'm terrible. I'm working till all hours of the night. I'm asking
Yeah.
these questions partly because I'm my own, that's one of my guilt locations in terms of
Yeah.
is sleep. So, all right, let's go to the next myth, which is that testosterone replacement is risky.
Mhm.
And that's kind of a double-edged one, because obviously there's, again, all these high T, the commercials for here's your testosterone supplements. So what's the truth that people need to understand about what's being, that the difference between when I come to you for testosterone replacement therapy versus when I go, to respond to all these ads that are all over TV or the internet or whatever?
Yeah. Well, my answer would be, compared to other medications, testosterone replacement is not risky, assuming that a person has an actual deficiency to begin with, and you're getting them at levels which aren't out of range, way too high, and that you're monitored properly. So assuming those things, no, I don't find it risky at all. I mean, I've had, I don't know, I'm sure well over 1,000 men in my career on testosterone replacement, probably as many women. And I mean, it's rare I see anything other than some mild side effects that we can't deal with. Now, that being said, there's a lot of doctors out there who prescribe it to patients, don't even test them, or they don't test them properly, or they don't even recheck them for a year or longer. And so they're not being monitored properly. I got patients who go down to Mexico and you can get it in the pharmacies there without a prescription. You got a lot of kids in high school, college, getting on the black market at gyms and stuff like that. So that's where it can be risky.
That do-it-yourself stuff, again, talk to the professional and get it properly prescribed. Is there anything with testosterone replacement about, in the female hormones, there's bioidentical hormones versus pharmaceutical hormones. Is there anything that people need to be aware of type of testosterone hormone replacement?
Oh yeah, I mean, fortunately, all the testosterone's available from the regular pharmacies or compounding pharmacies is bioidentical. There's different forms. You have the topical or transdermal form. So that's where you have creams, gels, or lotions which contain it and absorbs through the skin. You apply that usually in the morning. Then you have the testosterone injections used more by the men because they're using higher doses. Normally inject 1 to 2 times a week on that. And then you have the testosterone pellet implants, where you get a pellet. It kind of breaks down over time. You can have good levels for about 4 months. So those are the 3 main ways. There are some patches that are out there now too. There's sublingual as well, but the 3 main ones are the topical creams and lotions, the injectable, and then the pellets are the main ways it's used.
I'm going to ask an obvious question. If I'm a 60-year-old with low testosterone levels versus if I'm a 30-year-old with low testosterone levels, is it a different strategy for treatment?
Oh, absolutely. I mean, if you have a 30-year-old and you have testosterone deficiency, which I've had men like that, I am doing a lot more investigation before I'm treating the patient. I mean, there's something going on as to why their testosterone is deficient. I mean, maybe they're a heavy marijuana user. That can suppress testosterone, studies show. Maybe again, they have problems in their pituitary gland in their brain, so the messaging system isn't correct. Maybe they have a genetic condition, like Klinefelter's, which is causing the problem. So I know when you're young like that, I'm not prescribing testosterone. I'm doing a lot of testing to find out what's going on. And in younger men, even before I give testosterone, let's say for whatever reason we can't find, a pathology per se. In the younger men, let's say from 30 to 45, then I'm usually using other things. I'm using things which stimulate the testicles to start producing testosterone, get them restarted, kicked in, so to speak. So, for example, you can use like a hormone called HCG, human chorionic gonadotropin, which the hormone goes up during pregnancy. But that has been shown to stimulate the testicles to start releasing testosterone on their own. There's another drug, it's a fertility drug called Clomid, and that we use with younger men too. I won't get into the details, but it just helps with the messaging system from the brain to the testicles. So for some men, we can use these things for a period of time, and then they don't need them. Their own system, the communication networks are working on their own, and their testosterone normalizes out.
Gotcha. All right, I have one more question, and then I've got a couple questions that have been sent to me. And if anyone else has questions that they have for Dr. Mark, put them on into the chat, and we're going to do a little Q&A if we can, Mark.
Okay.
Is there anyone that should not? In your book, you talk about there are certain groups of people that should not necessarily get hormone replacement therapy. We already talked about if you have a fertility problem that you should not do it. But there were a few other kind of categories of people that you talked about if they had elevated PSAs, if they had prostate or breast cancer. Want to talk about that for a moment?
Yeah, any of the active hormonal related cancers, say like breast cancer, prostate cancer, ovarian cancer, these very hormone sensitive cancers. We have to keep in mind that when your body makes testosterone or when you take it, some of it is converted into estrogen. Right. So, if you have an estrogen, sensitive cancer, that's a problem. So, not in those cases, although there are more doctors nowadays for men who have a history of prostate cancer. Maybe it's been 4 or 5 years. They have testosterone deficiency, no signs of active cancer. They had their prostate removed. It's becoming somewhat semi-normal now to get those men testosterone replaced and be monitored properly. People that have thick blood, they have their red blood cells, hemoglobin is too high. For some people, testosterone tells the bone marrow to make more red blood cells. So if there's something going on with the condition like that, sleep apnea. For some people, testosterone can aggravate their sleep apnea, especially the more severe form. So usually you don't use it in cases of severe sleep apnea unless they're being treated and monitored.
Is there any connection between testosterone levels and sleep apnea? Like
I haven't seen the exact mechanism. I can only theorize maybe like increased, muscle and tissue and stuff like that might be the relationship with that. Or people who've had like a heart attack, let's say in the last 3 to 6 months, or stroke. Now, testosterone itself, when you look at the data, really in the last 5 years, very large studies, they have not found testosterone replacement as a risk factor for cardiovascular disease. But remember, let's say you're a person prone to making blood clots, and if for some reason not being treated properly with anticoagulants and stuff, and another doctor, unbeknownst, say to your cardiologist, has you on testosterone, and maybe you're not well regulated and you start forming blood clots, obviously that's a problem. So those are things you got to be more cautious with and get proper consultation.
Gotcha. Okay, let me go to some questions that I have. I'll have to scroll back up. They've been sending them to me. So Belinda asked about whether testosterone can help with her myositis. And can you define myositis for everybody?
Yes. Yeah, myositis is a fancy way of saying inflammation and pain of the muscles.
Okay.
It depends what the cause is. Myositis can be related to an autoimmune condition. The immune system's attacking your muscle tissue. It could help in those cases. It may not be, a pronounced benefit. Again, if you're just a person who has kind of muscle inflammation, don't recover well, the cause isn't well known, get your testosterone levels checked. It may be a benefit.
And can taking testosterone help rebuild the muscles if you've got?
Yes.
Yeah.
As a matter of fact, especially in people who have sarcopenia, loss of muscle mass, like in seniors, yes, testosterone is very effective for it. That's why the bodybuilders and the athletes love it, right? It gives them lean muscle mass. All
right. Now, I've got from Kelly, well, we talked about a little bit that women do need testosterone, that we do have it. When would women need testosterone supplements?
Well, if they have the symptoms of testosterone deficiency and the lab work shows a testosterone deficiency, the doctor is justified in giving it to the patient and see if it helps their symptoms and monitor their blood levels.
And
so
for women,
we see it mainly in middle-aged women for the most part. And women between 45 and 55 are most of the cases we're seeing where it's dropped and they have several symptoms. we give to the patient, it's helpful. We do also, my practice and other doctors, we do use it in women and men who have osteoporosis as kind of an anabolic agent to help with bone density amongst, including doing the diet and exercise and all that.
And when you start giving people these supplements, if they're younger, if they have lower levels than they should, I'll call it for their age, and there are other extenuating factors, be it sleep or whatever, is the testosterone potentially just temporary while you build yourself up and get your system kickstarting again while you do other things to help your body, diet, exercise, sleep? Or is this once you're on it, you're on it forever?
Good question. I mean, you could do it that way, but like I said, if it's a younger woman or younger male, I don't prefer to give it at the beginning. I'd rather dig deeper, see why they have a problem, use the natural agents we talked about, including the diet, the herbal extracts. Most of those cases, when we do those protocols, they work just fine. It's only a small percent where we have to go to something more like pharmaceutical in the younger people. But testosterone, when you're on it, no, you can be on it and go off it and your system could work fine unless a doctor has been overdosing you for a long period of time. So for example, I had a male come in a few years back. At this point, he was probably about 23, and he had his uncle actually was a medical doctor, and actually when he was in high school provided him testosterone prescriptions, and so he was using it for building muscle. And so what had happened was he was getting massive doses and he put on a lot of muscle, but what happened was it resulted in him being infertile the rest of his life.
Wow.
And he had testicular and penile shrinkage from abusing testosterone at a younger age. So in his case, it's considered irreversible when it's went on for too long of a period of time.
Right. And he was so young.
Yeah.
Right. Let's talk for a second about the difference between testosterone and all those steroids that the bodybuilders like to take. Can you just clarify what one versus the other? Not that anybody should be taking those anabolic steroids, but
yeah. Well, I mean, technically, testosterone is an anabolic hormone, and that's just a fancy way anabolic means to build things up. So technically, it's an anabolic hormone. That doesn't mean it's a bad thing. I mean, our body needs it, right? So the main thing really comes down to with the bodybuilders, when you look at the amounts they're using, and I've seen them, and I refuse to prescribe testosterone for bodybuilders, athletes, where it's not indicated. I don't just give it to them for their performance and building muscle. I don't do that. That's actually not considered ethical or good standards of medical practice. But it really usually comes down more to dose. When you look at these people, they're taking 2 to 3 times the amount we normally recommend to people who are deficient, and they're not even deficient.
Right.
So, yeah.
And obviously the steroids themselves that they're taking, those are just, shouldn't be doing that at all. When the bodybuilders are taking the steroids on their own.
Yeah, I mean, it's not even so much the forms of testosterone using, it's just the mega doses they're using, throwing off their whole endocrine system. It's like anything else. I mean, if you overdose someone with testosterone, they can get symptoms. I mean, long term, you could cause heart enlargement. You increase the risk of diabetes. You can increase the risk of arthritis, water retention, high blood pressure, aggressiveness, depression. Psychological things. So, it's like everything else. If you're going to do it, only do it when people are deficient and get them into like a normal level.
Yeah. Our bodies have a normal place we want to be. All right. I have a couple other questions. Can testosterone issues lead to prostate issues over the age of 50?
It's a good question. The research is very clear in terms of prostate cancer. All the research thus far, and there's been a lot of large studies done. I remember one study done with 20,000 men. They have found no association between testosterone replacement and prostate cancer. That being said, for some men, a small percent, we do find that testosterone replacement can aggravate their prostate in terms of like BPH, prostate enlargement. Not cancer, but enlargement, which, BPH or prostate enlargement, which is non-cancerous, is very common in men. So there's a small percent of men we find that with. Normally on these men, as we're monitoring their blood work, you'll see their PSA rising pretty quick. Which, for us doctors kind of gets our attention because you're either thinking, prostate irritation, inflammation, enlargement, or you're thinking cancer. So, we always look into it in those patients. So then if you cut the dose back or get them off it, the level goes back down again.
And how about if they are testosterone deficient? Will that also have any effect on the risk of prostate cancer?
No.
Okay.
No. But even in men who are, testosterone deficient, there's a small, very small, I mean, I maybe see 1 in 200 men where you promote testosterone and their prostate doesn't like it. Now, maybe the dose you're giving, it may be they're converting it into estrogen too readily, or the hormone dihydrotestosterone. Those are the hormones which aggravate the prostate, estrogen and dihydrotestosterone, not the testosterone.
Got it. Okay. Another question. Are some women treated with both estrogen and testosterone?
Oh, yeah. I mean, we have a lot of menopausal women who are typically on natural estrogen replacement, natural progesterone replacement, natural testosterone replacement. It's not uncommon to get all three. I mean, usually hormone deficiency does not occur in isolation.
Right.
If you're low on one, you're probably low on other ones.
Mm-hmm. Okay. All right, Dr. Mark Strengler, you're amazing. Remind her to everybody, the book is Healing the Prostate. And it's great, as all of Mark's books are. So go check that out. Go get that. Go check out his other books, because they are all fabulous reference books. I had your books on my bookshelf before I even knew you. They were already on my bookshelf as reference books, believe it or not. All right, and don't forget, everybody, download the immune book, download the pain book, tell your friends about our channel, tell your friends about the YouTube channel, and come on back next week. And it's going to be a surprise. We're working on something special. All right. Thanks so much. We'll talk to you soon.